welcome back to the Technology Evangelist podcast. I'm Dr. John Fluke, Technology Evangelist, and today's going to be fun. One of the things that is kind of a pain about the world we live in is we're all super busy. And the old expression, back in the 80s, they said, well, technology is going to make things so easy that we'll have a 20-hour work week. And no, in reality, we have a 40-hour work week, but people expect us to get 80 hours worth of stuff done in it. So our relationships suffer, and I don't get a chance to hang out with my friend Bryan nearly as much as I'd like to. But my guest today is Dr. Bryan Laskin, who is speaker, consultant, a really good dude, and an author. Got a copy of his book, Dental Disorder, here, which is a great read. I highly recommend it. And with all of that being said, Bryan, thanks for being here. I appreciate it.
Thanks for having me. Yeah, it's an honor to be here. Appreciate it. And I consider myself a technology advocate too. So it will be two like minds working together today.
Cool. Well, I knew this would be a great conversation. All right, I always start off with the origin story, my friend. People love to know how people got to where they are, and I think it's fascinating. So, start wherever you want. You can start as a little kid. I mean, people know that I wanted to be a dentist when I was 3. So take me on your path and how you got to this point of, being an author, an expert, heck, even doing your own podcast. Tell us how you got here.
Well, thanks. Yeah, it's a convoluted story. Mine, my story takes a lot more twists and turns, I think, than the average dentist. But probably starts off when I made a decision to be a dentist due to a lot of flawed logic, right? So I like doing things with my hands, like playing guitar and painting and things like that. And I wanted to be in healthcare to help people, but the flawed, that's all true. But the flawed part comes in where I have like ADHD and can't sit still. And every dentist I met was very calm. So I thought, oh, it must be a calming profession. And so that's one of the reasons why I went into dentistry.
Obviously.
Yeah, that's not the case, right? It's not a calming profession. And so as a dentist, I've always been sort of striving for efficiency and higher quality. Very much, I'm kind of a sensitive person. So I'm very sensitive to patients' anxiety. So I've always really honed in on the patient experience from very early on in my career. And also I love technology. And so early on in my career, I started CAD CAM study club, which led to me doing lots of training and working with lots of different manufacturers in the CAD CAM CT imaging world. Then about a decade ago, started creating our own technologies, created a platform called Opera DDS. That's a patient engagement solution. We scaled that to 30,000 dental practices, and I sold that a few years ago to focus on what the book you showed, Dental Disorder. Really, I created Opera to solve problems in my dental practices. Now, I sold my dental practices to focus on Opera, which again, which was really solving problems in dental practices. And then my platform I'm working on right now, Tooth Apps and Care, really is focusing on what I think is the biggest problem in dentistry that I found scaling Opera, and that's how data is managed in dentistry. And so that's what the book is about, Dental Disorder, what I think is the biggest problem in dentistry, which is the lack of access and control and visibility into what's happening with our record systems. Specifically, my goal is to empower patients with their information. And that's what our application Care, which is spelled CAIR, does. And so that's kind of my journey along the way to help support what I'm doing. I do a lot with standard development. If you think about how data is managed, we're in this sort of weird position as a disruptive technology that is not acting to break rules, but to actually enforce them and create them so that we can fix this quagmire of a cesspool that we call dental software, right? But I guess that's kind of a long answer, but it's been kind of a weird, windy journey from dentist to, I guess, executive at a DSO, software tech entrepreneur. I work with a lot of different startups in dentistry now really working with the federal government and a alliance to help try to bring order to the chaos of dental software and empower practices and patients to provide better care.
It's funny because you talk about this deluge of data, and it's so true. Um, I went paperless in probably, I don't know, 98 or 99. And I used to actually do a course on, how to go from analog to digital across the board. And one of the things that I would talk about was backing up. And I remember that when I started giving that lecture, I had a slide up to show how affordable it was. And it was like, your data, you can back up your data for like 5 cents a megabyte. And I mean, that was a huge deal back then. And I don't do that course anymore, obviously, because nobody needs it. But I remember that when I got to the end of that, when I finally retired that program, that slide said you can back data up for like 0.0000001, whatever that is, per megabyte. And you see it with phones, somebody, well, I'm going to use your book as a prop, but you've run into a friend and you're talking or having dinner, and then somebody says, oh, I want to show you this picture. They pick up their phone, they go. Because when you've got a high-end camera in your hand and you can take a picture anytime you want to, why not? It's not like I got a 36 exposure roll and I can think, I don't want to waste them all. There may be some really good shots. And it's that tying this back to what you were talking about, it's that way in dentistry. People come in and we input all this data, photo, scans, CBCTs, all of that stuff. And then suddenly you need to go back, oh, I'm going to do an endo through a bridge. But I know that when I did that bridge, I can remember the teeth were tipped, somewhat. So I need to go back and look at the scan on that and see, what was the angle so that I make sure I don't perf on the endo axis or whatever it is. And then you're digging and you're digging and you're digging. You got to open something different to look through it. Sometimes you got things that aren't even in a format that can be read anymore. I mean, the data is great, but we're drowning in it.
Well, yeah, but we're also starving for it because,
Yeah,
I love the case that you presented, with a tipped tooth where the records are uh, vital to actually not perf the tooth, right?
right.
The first thing we do when a patient's in our care that we look at a kind of a situation like that, and there's, we could detail 100 different situations where you
Sure.
go, okay, I need to look back and see what happened when we did that, right?
Mm,
But if that patient had that bridge done in another practice, we
yep.
pretend like the records don't matter, right? It's absolutely crucial to have that information to provide the best quality of care because, if we're going to drive revenue in our practices, we have to do treatment, and to do the best treatment, we have to come to a correct diagnosis, which requires the information. And in the case you just mentioned, not just a diagnosis, but how do we actually provide that care? And what we're trying to do is make it so that it doesn't matter if you did the bridge or if it was
Mhm.
done, a decade ago. As
Right.
long as that was captured in an electronic record system, you'll have access to that information, right? I think that the reason why we have so much information, to your point, is because it's required to give the best quality of care. But when
Right.
we get a new patient, or that if you're a specialist 100% of the time, pretty much because it's getting referred to you, you don't
Right.
have the information. It's if you think about it,
Yeah.
it's ridiculous, right?
Yeah. I had kind of along these lines, I had a patient um, who had come in and he'd been a long time patient and he got a sinus infection and I didn't know about it. And he left, he went to an ENT. I remember he came into the office for a consult appointment. And this is probably 15 years ago. He came in with this huge manila envelope And he said, yeah, I had to go to the imaging center and they did a CT and they said that you should look at, like the upper right first molar. Well, okay, so I looked at the upper right first. I mean, I had to like, take these huge pieces of film and look at it and finally found it. And it was, yeah, pretty straightforward. I mean, he's got a periapical radiolucency. It's draining into the sinus. But had he not brought that in, then we would have had to take x-rays and expose him more. And then there's all this stuff just sitting around somewhere. And you're right that if it's interconnected, it's so much easier. Um, I mean, especially because I don't see it as much as I used to, but I do still see it sometimes from people that have been practicing as long as I have, some of them longer, and we'll request records. And what we get is 8.5 by 11 laser printed copies of digital x-rays. I'm like, what are we going to do with, couldn't you have just emailed that securely or, whatever? But if it was all just in one repository somewhere where we could get it, genius, so much easier.
Yeah. I mean, I think it's, and it's 2025 right now, right? Like, why doesn't that already exist? And so that's what we're building. And I, to your point too, the medical dental connection is a big piece, and people
Yeah.
are talking about medical dental integration. But frankly, I think there's some people who are doing some really cool things with it. But in my mind, we need to connect our systems too, because I mean, take for example the medical history that we use in dental practices. We pretend like, I mean, let's just call it what it is. We use a medical history as a screening tool, not
Yeah.
as like an actual way to gather information to take care of patients, because as we're all aware, patients don't give us their comprehensive medical history.
Right.
A, because they don't think we need it, which obviously that's incorrect. And
Right.
B, because the worst way to get information from a patient about a patient is to ask them it, right? Right. I mean,
Yeah. Yeah.
they're a very poor source of information,
Right.
right? So why don't we have the exact same medical history that the physicians have, right?
Yeah.
And then have it. So we're doing those connections too, right? Because I mean, not to say that you can't have your own medical history, but at least being able to review what the physicians have on record too, because then you can have the conversation with the patient, like, oh, say, I did notice that within the last year you were also diagnosed for diabetes. Were you aware that your periodontal disease may be actually affecting that? And and which is obviously where most people today are practicing, is in, who are focused on the, oral health as the gateway to overall health. They're
Right.
bringing in sort of overall health elements. But if we don't have the information, we're kind of just, walking blindly through the dark, right?
Yeah. And, it even goes back to the whole thing of prescriptions, because patients, they come in, you do the intake form, you have, if you're lucky, they list the medications they're taking at that time, but that changes, and if they don't tell you, or somebody doesn't think to ask them anything changed about, the medicines you're taking or whatever, once again, you're just, out there flying blind, which is tough. It'd be so much easier to not, and I think that's part of it too, is the time involved where patients get frustrated, because it's like every time I go to every office, I have to fill all of this out. And if we all had access to it across the board, they probably wouldn't have to fill as much stuff out. I mean, that would be tremendous.
Yeah. Oh, here's a pain point that I think everybody that works in a dental practice probably will identify with, that this type of information that we're working on right now, why do we have to follow up with patient's dental insurance, right? It's
Mhm.
not our insurance. If you have a knee replacement and it gets denied by the insurance, you don't call your doctor and say, hey, can you help me with, and no,
Yeah.
because you have the information. The reason why patients don't follow up on dental claims right now is because they don't have the information. So let's give it to them. And then when the patient says, hey, why was my crown denied? You can say, oh, I don't know, look in the application. You can look at it yourself and you can
Yeah,
follow up with it versus having, Sally at the front desk sit there for 2 freaking hours talking about somebody
right.
else's plan, right? Yeah.
Yeah. Yeah. The one phrase that always frustrates me is when a patient will say, they don't normally say it to you and I, but they'll say it to staff. I thought you guys knew my dental insurance. Like, that's like saying, I thought you knew my car. When you take your car in for a repair, you don't expect them to know everything about, I don't know. It's frustrating to me. We've kind of spoiled our patients, I think, in that regard by taking that burden off of them. But I think some of it too was a service because the insurance companies make it so complicated that you have to have a PhD in insurance speak oftentimes to comprehend things. But like you said, if they had all that information, and you're right, when somebody has a knee replacement, it's denied, they don't call the doctor and say, hey, what happened? Or can you, I don't have that kind of money. Can you work a deal for me? It doesn't work that way.
Yeah, and I think the core issue is the fact that it'd be onerous for us to say to patients follow up because they don't have the information,
Right,
right? So once we give the patients that information, then they're educated and they can actually follow up on their own. It's right there. It's right in front of you, right? I mean, it just makes all the sense in the world, and I think that's why on the hospital side or on the medical side, patients tend to follow up on their own versus requiring obviously, if there needs something needs to be refiled or something,
right.
the administrative team is going to get involved. But that first step or follow up, or we should just. But that's just not the way that it's been working in dentistry.
Yeah,
There's no transparency for patients. So at that point, either we take on the role to like transmit all of this information to all of our patients, which is
right.
which is a bigger problem,
Yeah.
or we just deal with one patient at a time, right? Uh, yeah. So
So
I
how
think,
do you see this? I'm sorry, how do you see this going, Bryan? Because obviously you've thought about this long and hard. Can you kind of give us like an 80,000 foot view of how you see this being handled? Because you're a smart guy. I mean, you've done this kind of stuff before.
yeah, thanks. So I've been working on this problem for about 4 years, right? And what we've been doing is laying the groundwork through standard development. So both I co-chair the work group at the ADA on interoperability, and then I led the creation of another standard development company called Dental Standards Institute. And standards are kind of a boring, nerdy topic that I love, but really what we're doing is we're kind of like writing the rules for open standards, which means that there's not this like proprietary things. You can think about it like, a USB plug for your phone, right? If
Right,
everybody had their own connectors, it's all convoluted and a mess. So what
right,
we've been doing is basically creating this sort of like USB system for dental access. And now we've just created an alliance called the Oral Health Interoperability Alliance, or HIA, which we had a convening in Washington about a month ago. There's a lot. This has been a bipartisan effort for about 20 years on the medical side. And now we actually have an alliance of really the biggest companies in dentistry that are part of it too. And it's Dental Standards Institute. We're working with a company that bridges sort of like public and private and all the sort of relevant people from the federal government are observing. So I think we're very close to having federal mandates and either incentives or disincentives to kind of align everybody into having what's going on the medical side is you can't just have your own USB plug. Everybody speaks the same language. But
right,
dentistry has completely avoided speaking that same language. And so what we're doing is actually converting all of the data to be very similar or the exact same as the medical side, but then just expanding it on it to include dental stuff. So what does that mean for dental practices? It means that
yeah,
you won't have to ask, does this integrate with my practice management software? Right?
right,
You won't have to worry about when a patient requests their records, right, they'll just be instantly available through a secure mobile app, right? And so if you think about like my chart on the medical side,
Mhm.
We already have an application that does that and more. Then patients can pay their bill, do secure messaging, online scheduling, everything that you'd expect. You know, basically from a hamburger stand that has an
Right.
application, right, is available for your dental practice. And then I also think, and this is kind of a diatribe because I've thought about this a lot, like you said, dental practices, if you think about it, well, this data, the electronic dental record is owned by the patient, right?
Yes.
So they should have access to it through a secure mobile application, like I just mentioned. But a very big issue for dental practices that nobody talks about is that dental practices are the stewards of this data, which means that you are responsible for the data, not the software companies necessarily, because they protect themselves
Right.
legally. They actually have some responsibilities, but who has access to what fields and all of that? You as a dental practice are responsible for. And so by the end of this year, probably in about 2 months, we're actually going to have a control center for dental practices to actually be able to handle that responsibility. And I
Wow.
think that that's a key piece. So what has to happen in my mind, and I think is really inevitable, is having management that goes in alignment with other parts of healthcare, and also we have conveniences for our practices and for patients that are better than you would expect from a taco stand, right? When it comes to like how we engage with our consumers.
Yeah.
Right?
Yeah. No, that's, and one of the things I want to bring up that you just said, because I think it's really important, but you said three letters, you said ADA. And for the younger docs watching this, the ADA is important. Now, I'm not somebody that if they make a mistake, I don't call them out on it. I mean, everything in the world is a yin and yang, and people do things that they think are smart, and then they do other things, and they're not so smart. And the only way you learn is by making mistakes. But that unified voice of working on things like what Bryan's doing, you need to have a way to connect people and that kind of thing. And if we don't have some type of organization with a unified voice that can help us, you know, coalesce as a profession and then take that message to legislators, then we are just a taco stand. So we need that. The other thing I want to bring up is that they're not paying Bryan to do that. And they're not paying all those other people. I mean, you're doing it out of the goodness of your heart and out of your own back pocket because you want to make things better. And so kudos to you for that. I mean, seriously, there's a lot of stuff the ADA does that people don't ever realize. But if it went away, it's like oxygen. I don't even think about oxygen, but if I don't have it, I notice right away.
Yeah, I mean, obviously, there's some structural issues that they've had that been
Mhm.
dealing with.
Yeah.
In fact, there's a story about how I got involved with the ADA standard development in the book you mentioned, Dental Disorder,
Yeah.
and it really comes from me being very frustrated with how standard development at the ADA was going. So I
Hmm.
led the creation of another standard development organization because I'm not, I'm a change agent, right? So
Yeah.
not only does this do I not get paid, I spent like hundreds of thousands of dollars to create another standard development organization, right? And which is doing great stuff. But then, frankly, what happened? I saw a massive change that was positive at the ADA, and I think that like Brett Kessler and others there who
Yeah.
are doing great things, and so we collaborate, which is the way standards work. And then I work with the ADA. I agree completely with everything you said. I do think that there are some challenges that they have that I love the transparency that they've recently been
Yes,
doing.
I do
I
too.
think right.
Finally. Yeah.
And so I think the sort of negative press around the transparency I think is problematic. Like, we don't because there's a couple pathways that the organization can go. And
Right.
I think we as dentists should be supporting them to go down the pathway of transparency and without, you know, throwing mud at them for, maybe things that haven't gone the way we would want them to in the past,
Right.
right?
Right.
Let's just focus on the future. And I mean, I think but I agree with you with everything you said. I think it's an important organization, I think it is also important for dentists to speak up. I mean, I think that what probably got us here is that dentists are so busy and overwhelmed that they
Mhm.
haven't really been paying attention,
Yeah.
right? And when I go to the standards meetings and when I get involved with the ADA, you're exactly right. There's a small group of people who are there doing things, and if more people would just pay a little bit of attention and speak up when things aren't going well, I think it would have positive change. But it is obviously the strongest voice today that we have in dentistry,
Right.
so it's an important one. I think having having a choir versus a solo of voices probably makes the most sense.
Yep.
But I also think that maintaining the ADA as, because it's not just dentally recognized. Patients recognize it. The AMA and the ADA kind of like are well known. So that the government officials kind of pay attention to it and things like that too. So I agree with you. It's important. I don't think it's going anywhere. I think it's, kind of too strong to be to fail, so sort of, so to speak.
Right. Yeah.
So, but I agree that, so I think that having dentists get engaged and pay attention, I think makes a lot of sense.
Yeah. I mean, the frustrating part for me is when people complain and then don't do anything about it. It's like, oh, they, whatever it is, doesn't have to be dentistry, but you'll hear people complain about like, Jiminy Christmas, people are driving through my neighborhood at, it's a 30-mile-an-hour street and people are driving through at 40. And I'm like, well, have you, you know, called the police, not 911, but like an information number? Or have you gone to a city council meeting and said, we need, better traffic speed enforcement on my street? No, but people ought to know better. They ought to slow down. I want to pull the Dr. Phil and saying, how's that working for you? Because it doesn't, you've got to speak up. You've got to have a voice. I honestly think a little bit, Bryan, and you and I both love tech, but I think one of the things that's kind of got us to the point with the ADA, at least that we have right now, is that we're so connected now that I can connect with dentists around the planet. And when I started, if I wanted to talk to other dentists or get any advice on anything, I went to local study club or the local component society meeting. That's kind of where you hung out and got to know everybody. Well, now you don't necessarily need to do that. And people, I feel like the individual doctors have kind of lost touch with that. If you grow up and you never ever go to a meeting like that because it's not necessary, you don't have time for it, then you lose that. And I think the transparency is a great thing, but I don't, we also can't just hang on to this, anger about, well, there was lack of transparency. And it's like, okay, they apologized, and then it's like, well, they need to apologize more. I'm like, they apologize. What, are they really, really sorry now? We're making steps, It's kind of like, you turn the corner in a building and you bump into somebody. You're like, oh, I'm so sorry. And they're like, yeah, well, you shouldn't have bumped into me, idiot. And you're like, okay, I'm sorry. I'm sorry. But if they're still angry, I mean, what are you going to do? You got to move on.
Well, I agree with you. And I think, it's the irony of the connected world, right? It's the same, like, social media.
Yep.
There's people aren't having personal in real life relationships
Yeah.
anymore. So they're like, it's leading to isolation. And the same thing is kind of happening, to your point, like with when it comes to our industry, because I go to a lot of different events.
Yeah.
I went from a dental practice event to a DSO event to a standards meeting, and there's almost zero overlap in those people, right?
Mm.
So if you go to the ADA meetings and then you go to a DSO event, now the ADA was actually going to those, and now they just announced that they have to, due to budget cuts, they're not doing that
Right.
anymore. But there's FQHCs, there's the insurance payers. I mean, the people in different events, even within dentistry, don't communicate to each other. And
Right.
that becomes problematic to the point where, for example, with the rise of DSOs, and then you have a lot of associate dentists who in DSOs that think that the ADA isn't relevant to them because when they
Yes.
go to their meetings, it's not that they're not exposed to what the ADA does and they don't really know it, right?
Right.
And so I think we have to break down those silos because I think it's problematic. And because that sort of the irony, like I said, is that the connected world leads to us kind of forming these fiefdoms or
Yes.
groups that don't talk to each other.
Yeah.
It's amazing to me on my podcast. I've been bringing on physicians to talk about medical dental integration because everybody talks about connecting medicine and dentistry, but I
Right.
don't think many people talk to physicians about it. It's like,
I
well, if we're going to
agree.
connect, we should
I agree.
probably have conversations with them, right? And I got to tell you, it's very enlightening because you talk to a physician about the dentist's role in sleep apnea. Oh
Yes.
my gosh, is it a fun? It's very different than what we think, right? So, but I think we have to start with kind of like bridging these gaps in our own just like right. I mean,
Yeah. Yeah.
you probably go to an endodontic meeting, which I haven't gotten to those, but there's probably nobody that goes to general dentist meetings. It's probably completely different, right?
Yeah. Yeah, it is. Uh, Real quick, you mentioned your podcast. Plug podcast. Tell us a little bit about what you're doing and why you got into it.
Well, for me, I'm a change agent, and another way
Right.
of saying that is we like to create innovation, and another way of saying that is we want to improve things for everybody,
Right.
right? And dentists are busy, they're overwhelmed, and dentistry as an industry doesn't like change. And so a
Hmm.
lot of it comes down to
Wait,
education.
howdy.
So for me, the books, the podcasts, speaking, it's all about kind of educating the community, our industry, kind of on the next phase, the next step. Because what we tend to do is kind of like help define, shape, and deliver that next phase, right? I've done that a
Right.
few times in my career. Today, it's about data access and interoperability and patient empowerment and connected dentistry, so like we're talking about. Um, and so for me, the podcast has been about that. And so the theme for everything, my first book is called The Patient First Manifesto, because I
I love that
believe.
title, by the way. It's a great book. I love the title.
Thank you. Yeah, I mean, it really talks about the barrier between patients and dental professionals because there's a systemic difference between the way dental patients view dentistry and the way we view dentistry. And what I argue is that the best way to grow your practice is to align your practice in alignment with what patients are expecting, right? And so the podcast is a patient first podcast because at the end of all of these things that I'm talking about, whether it's interoperability or all the sort of different things that we focus on, medical dental integration, at the end of this, what we're really doing is trying to deliver dentistry for patients the way that they can is most accessible to them. And I think we lose that sight of that in the day-to-day busyness of practices, which I describe why in the book in the first book. It comes down to really uh, altruistic desire to provide the highest quality care, which ironically leads to us ignoring what patients are feeling and thinking and saying, right?
Yeah.
Uh, but right, so I think all of the systems and everything we're doing, I'm a dentist, as you are, right? So just trying to elevate the oral health of the population, originally as a dentist, but now trying to do it through technology that kind of breaks down these silos.
Well, and I think that's so important. It's a couple of weeks ago, somebody in the office was sick, so they brought in a temporary hygienist. And she was young, probably been out of school less than a year. And I walked by the op, and it's a multi-doctor practice, so it wasn't a patient I was going to see. But I heard the hygienist say, "Yes, no, I'm seeing some caries on tooth number 12, and it's probably going to require an mesial occlusal composite restoration." And I went back and told the other doc, I said, "You got to go in there and speak English because she's so fired up about the knowledge that she has that she's not communicating to the patient. Nobody knows our lingo. And, the other thing I think too about not delivering it the way patients expect is that I've always said, for me at least, in my little part of the world, once I've been in practice long enough to, I've seen a few things, I don't look at something and go, oh my gosh, how am I going to fix that? Then the whole thing kind of became this deal of like communicating with the patients. The hardest part is finding the time to communicate with them. And that's one of the things I think that's really great about AI radiographic analysis now is, computers, they don't get tired. They don't have blurry eyes. They don't come in and know that, your next patient's been waiting in this room for 15 minutes. You're 10 minutes behind on another patient and two hygienists are waiting for exams. So you come in and you kind of look over things and you talk to the patient for 20 seconds and you run out of the room onto the next adventure, and you don't get a chance to, deliver it, form the relationships, help the people understand. And understanding is, to me, kind of the key to the whole doggone world, if nothing else. If you understand other people, you're much less likely to have conflicts.
I totally agree. I agree with everything you said. I think, I mean, and I'm going to highlight one thing you said is this is hard, right? When we're talking about,
It's the
it's
multitask.
difficult in a dental practice to communicate with people like we're describing, and to, because people have a lot of anxiety about dentistry, and it's like slowing down and addressing that without absorbing it is a challenge that everybody faces in dentistry. It is a big challenge, and I agree with you with the radiographic analysis with x-rays. I think it's, anything we can do to help visualize. I think the next step of that is sending it home with them in their pocket, right?
Yep.
So that they can
Yeah.
talk about it with their spouse, right? They can look at their information, because let's face it, even if you spent 15 minutes with the patient, which let's face it, we can't,
Right.
people are overwhelmed. So
Mm.
how are they going to process all of that information in your office? The answer
Yeah.
is they can't, right? I mean,
Yeah.
if you have my chart, everybody goes home and opens it up and starts looking at it and processing the information at home. I think that's the key next step that every practice needs to make.
I love that, because you're right. I was a psych major in undergrad. And one of the things that has always stuck with me was that we perceive roughly 85% of our environment through our eyes and about 10% through our ears and the 5% from the other senses. And if you don't give people visuals, number one, that's why patients don't listen. They're not really, it's not that they're not listening. They can actually try to listen, but that processing is the hard part. And being able to go home, pull up the information on their phone, look at, the AI images that you've sent or, whatever. It just, nobody wants to make a snap decision. I think a lot of times with dentistry, you tell patients, you see something or you say, oh, I think you need. And then after the word need, the first thing the patient hears is horribly stress inducing, blah, blah. And they don't hear anything else you're saying. It may be that, what you're proposing is whitening, but if they jump to it's going to be bad, then, you go into fight or flight and you don't listen. So I don't think it's so much that people don't listen. I think it's that listening just isn't the right way to communicate the whole thing to you. So I think it's super cool that people can go home and look at your stuff and then kind of understand what you're talking about. Now,
Yeah,
I'm going to switch gears here for a sec, though. Do you want to make a point or?
yeah. I agree with everything you're saying. And then that we're just talking about the clinical side. When we
Mm-hmm.
go over to the business side, and
Oh,
your
yeah.
team is overwhelmed at the front desk and the patient's walking out and they have a treatment plan, you talk to the third party financing companies, they say the number one problem they have is the teams are too overwhelmed to even talk about financing, right?
I
So
agree.
if what you can do in the application is have all your financing options available, so that if your front office team doesn't go over it, all of it's just laid out for patients, in
Boom.
plain English, right in their pocket, right? So I think, you know, the number one issue that I think practices have today is not having enough team members that can actually do the work. But
Yeah.
if we can augment with technology that basically takes this effort and puts it on the patient who
Yes.
who's going to do it either way, either interacting
Right.
with a human being or they can do it through their phone. Uh, that's better for everybody, right?
Well,
So
you know,
in
I,
addition to having these sort of like treatment compliance from having the knowledge in their pocket,
right.
de-burdening your team, I think is a massive, massive assistance.
Well, and the phone, before I jump subjects, the phone, um, saw a stat a while back, from Google that said that smartphone users, the phone, and it's funny because, like so many people read the phone in bed, then they plug it in on
Mhm.
the nightstand, it's their alarm clock. So that goes with this. Said that 97% of smartphone users, or I'm sorry, smartphone users, 90% or 97% of the time, the phone is within 3 feet of that person. And like I said, it makes sense because you put it on the nightstand, you set the alarm, it's laying right there. But that's how people are processing the world now. I mean, tablets and desktop stuff is great. But most people are, accessing on the phone. So your whole idea of going through and making it mobile and making it easy to digest is great. What I was going to turn the corner with was just your new book, because
Hmm.
we've talked about Dental is Ordered. We talked about your first one a little bit. I know you got a new one coming out. Tell us about that a little bit.
It's right here. It's called Unfair
Hey.
Care. Yep, it comes out in October. Yeah, thank you. The Unfair Care was sparked by a personal experience. My wife was going through some health challenges, and we've been working on data access and interoperability and all of this, and then we hit this sort of like 6 months of misdiagnoses and just a
Mm-hmm.
complete mess that was all due to not having access to information, and also sort of you know, the argument I make in the book is that healthcare isn't broken, it's rigged, right? The healthcare system is working exactly as it's designed. We just have perverse incentives and some other issues, right, that are going
Yeah.
on. Now, so Unfair Care is a guidebook for patients on how to get the best care possible in a system that's designed to fail you, right? Now, I have quite a bit about dentistry in here. And I don't think it's a distraction, because I think we as dentists recognize that oral health is deeply linked and the gateway to overall health. And it's
Yes.
also the most disconnected uh, sort of systemic uh, organism or organization that's disconnected from the rest of healthcare, right? So we as dentistry are
Yeah.
outside of overall health, even though we are directly linked to it. So I do have a couple chapters, one talking about the links between oral and systemic health, and another one on what dentistry gets right and wrong and what medicine gets right and wrong, because I think dentistry and medicine are messed up in different ways, which means we
Mm-hmm.
can either like learn the weakest parts of each other as we
Right.
kind of like blend together, or we can take the best parts of each other. I map that out in the book too. But the overarching theme of the book, this is written for basically any human being that gets healthcare, to how to get the best healthcare you can.
You know, there was a movie you made me think of back in I think it was either the late 80s or the early 90s. It starred William Hurt, who was a very hot property at the time. And the movie is called The Doctor. Do you remember it? Have you ever seen it?
I know the movie. I haven't seen it though.
I mean, I'm not going to go over the whole thing, but basically, when the movie starts, he is like a really cocky cardiothoracic surgeon. He's good at what he does, and they show him interacting with a patient or with patients. And the one I really remember is that a lady comes in, she's probably in her 50s, and he's done surgery on her. She's got a huge scar on her chest. And um, and she talks about how that she's, concerned about her husband seeing her with this big scar. And rather than being compassionate, he says, "Oh, just tell him you look like a centerfold, even with the staples." And then he walks out, and this poor woman is just aghast. And then he gets sick. And suddenly the machine starts to process him just as a patient. And it's just really interesting. I've said for years, I really think that anybody that is in healthcare for a living should watch that, because it is kind of amazing to look at that and think, yeah, I probably do stuff like that. Yeah, that's pretty unfeeling. I could change that. It's just so I like the fact that you're helping people with this. I mean, doctors can read it and they can see the mistakes they're making, try and make changes, and the patients can read it and actually help navigate those waters, more completely. When's it coming out? October 7th, is that right?
October 7th. That's right. Yeah. And appreciate the kind words. And I think it is, obviously it's a guidebook for patients, but it also, I think, would be great for everybody who's in healthcare to read, right? I mean, I learned a lot. Just, it's one of those things that you learn. I learn a lot when I write books, and I was aware of the oral systemic connections. But as I wrote the book, oh my gosh, like what I learned was just
Mhm.
eye opening for me, and I think we are also entering, a new phase of dentistry. I believe this strongly that, when you mentioned before with your slide, when you're talking about digital dentistry, and now you've sort of sunset that lecture. My suspicion is because you probably intuitively knew that we're already deep into this digital dentistry era. In fact, I think we're coming out of it. The next phase I call connected dentistry, because I
Yeah,
think that, and a major theme, one of the major things with connected dentistry is connecting with patients and empowering patients and having patients being, you know, co-diagnoses, co-treatment
mhm,
planners. Like, we
yep,
have to incorporate their values into our treatment plans. We can't just dictate to patients anymore because
right,
they're too educated. There's too much information out there, and we have to collaborate with their physicians. And that's kind of what this book is about. It's about how, not just how the system fails patients, but how it fails healthcare providers, right? And how you as a healthcare provider can be the sort of change that can help fix the system. And I really think that the way to fix healthcare, even though it's not broken, because it
right.
isn't broken, right,
Said it's
is
working
to have
exactly the way it was designed to do, unfortunately.
exactly.
Yeah,
And so how are we going to actually have better care and like, better, a healthcare system, including dentistry, that's more focused on prevention and wellness. And,
right,
it's by having better educated, more engaged patients. And I know that that's not necessarily a popular opinion for
right,
to talking to dentists, but I think that's what's really I think that's the pathway forward, is if when we have engaged, not replacing a doctor's expertise, obviously, but having
right,
patients who are acting as the sort of the quarterback of their healthcare team. Because right now, you can't get their endocrinologist stuff.
right.
I mean, right. So until the day that you can actually, all of this stuff works, which we're obviously working towards that, the patient has to be that center point, right?
Well, and one of the things that I have become pretty passionate about in the last few years, actually, hang on, I want to jump. I want to tell you one thing real quick, and then I'm going to talk about this other thing. But when you were talking about this interconnectivity, um, it's funny because the way I see dentistry with the way technology has come into it is that we had this, what I call the invention phase, and digital radiographs and intraoral cameras and all these things. They were all standalone systems. I mean, you've been doing this as long as I have probably. And so you saw that where they were all separate pieces. And then suddenly the computer came to the operatory. And the computer became, I'll call that the integration phase, because the computer became the hub and all these techs became spokes off of that hub, and they all supported what we were doing. And then we went through invention phase 2.0, and that brought in digital impressions and cone beam and intraoral scanning and milling. And it like fragmented and it went all into all these pieces. And now I think we're seeing, I think what you call connected dentistry, I'm referring to it as integration 2.0, where we're trying to pull all these disparate pieces back together so that we've got, I mean, maybe control isn't the right word, but so we've got ease of access and ease of use. The other thing I was going to say, and this goes with what you were talking about before, was that healthcare, our ability, I'd like to change it when people get older from healthcare to health sustainability, because when people right now are reaching a certain age, our ability to keep them alive is exceeding our ability to care about them and give them quality of life. And this whole thing of you talking about, the oral systemic connection and connection with other healthcare providers and things like that. Nursing homes are full of people that are bound to those clinics. They can't get out. A lot of them, their mental competency isn't great. Some of them can't communicate, and yet they still need things. They could be in pain. They could have a fractured tooth that's cutting their tongue. They could have cancer. They could have, an abscess, and nobody knows what's going on with that. So I don't expect you to, give me a big discussion of that, but just, I think what you're talking about with bringing all of this stuff together and making dentistry a part of the overall healthcare, I think is exactly where we need to go.
Yes, and one statistic that I uncovered when writing the book, Unfair Care, was that 17% of adults in the U.S. are a caretaker for another adult, right? So usually it's an elderly parent. If you
Right?
think about that, so when you're talking about the nursing home patient, like it also includes the caretaker, the family member that's actually
Yes.
right, which
Yeah.
that blew me away. And so there's just, and we don't think about that when we're in our healthcare. Yeah, you're exactly right. And I think that, I want to be clear too, because I think that this gets lost sometimes when we're talking about medical and dental integration. I believe strongly that dentistry has to remain autonomous. The medical record and the dental record should be two separate systems. Even in systems like Epic, where they're the same, they're really two
Yeah.
separate interoperable systems. I think that like a true convergence of medical and dentistry helps absolutely nobody except for hospital systems. So I think that like when we're talking about, in my mind, medical dental integration is what you talked about before: interconnectedness,
Mm-hmm.
interoperability, working together, collaborating, but still two totally different systems. I think that's very important. But in the patient's eyes, right, they should have all their information in one place. They should have all their family members that they're taking care of in one
Yeah.
place, right? And they should be able to have tools and organization techniques and strategies that help them get the best healthcare possible. And that's kind of what we're working toward.
Well, and that is really so important. The other thing is that our world is now so mobile. People go everywhere. And I often think, like if you travel to another city and you're in an Uber and, God forbid there be an accident or something and you're unconscious and they take you to an emergency room, they don't know anything about you. I mean, they're just trying to provide the best care they can on the fly. But, what if you need IV antibiotics and you have an anaphylactic reaction to penicillin, or, just things like that? Or, what if you've just had your knee replaced and, your right leg is torn up? And I don't know. There's so many things that that interconnectivity will do to or do for us, because there's no way to do it now.
Well,
And
and I want
people,
to point out something that's probably going to
yeah,
that'll probably blow a lot of people's minds on this podcast, right? People think they understand HIPAA, right? Because you have to sit there for 3 or 4 hours and have somebody
yep,
yammer at you about privacy and security of data.
yep,
Every year, you have somebody come in and talk to you about HIPAA, right?
yes,
However, so we think about it as privacy and security of data. Now, there's
yeah,
a privacy rule and there's a security rule in HIPAA, but HIPAA stands for the Health Information Portability and Accountability Act, which is exactly what you described there. We're mobile. Per HIPAA, our data should be mobile with us. It should go with
I
us. That's the
love
whole
that.
point of HIPAA. And we
I
sit there
never
for
thought of that.
I
That
mean,
is
so
a
think about
mind
that.
blower.
So for
Yeah.
the last, and you had
Oh,
HIPAA training every single year for God knows how many years, probably over a decade at this point,
oh, easily over
and
a
nobody
decade.
points that out.
Yeah,
The entire title of what it says, Health Information Portability and Accountability Act, has nothing to do with the security rule, nothing to do with the privacy rule. Those two are very important, right? But
right.
this is such a problem that that's what the entire regulation was written for. And we have completely ignored it in dentistry to the point where it's mandated that we have to have training on it that nobody even points it out. It blows my mind. It absolutely blows my mind.
That's well, and along those lines too, I remember, because this was an interesting stat. In, I think it was 2006, people can look up ADA Las Vegas and see what years the meetings have been there, but I think it was 2006. And the keynote was the Secretary for Health and Human Services. And I don't know that this is the only stat I know, so I don't know where we are now. But the stat was that they thought the government was projecting that by 2030, about 20% of our GNP was going to be spent in healthcare. And that the concern of the minds back then was a country that spends like 1/5 of their money on keeping people, healthy and happy is not sustainable. There's not enough, funds to go around to do all that kind of stuff. And they were, even back then, I remember that the talk was kind of about, dentistry and medicine need to get, common things, because we need to make things easier and more streamlined. And here it is 20 years later almost. And I never even thought about, I've read the stupid HIPAA, name for at least 2 decades. I think it was 2004, 05 or something like that. And
Yep.
yeah, I never noticed. I never even thought about portability.
Well, what's shocking to me is that that we have training every single year and people don't talk about it,
Yeah,
right? It just blows my mind. And that's literally the title of, it's not, you don't even have to read the thing. You just have to
yeah,
just not say HIPAA, say the actual regulation. And
yeah,
it just details out exactly what it's supposed to mean, right? Yeah, it's just sort of, that's kind of like, well, so I went to Colorado and we went to a Rockies game
okay.
and, and they lost 15-1. I don't think I've ever seen a professional team that was worse than the Colorado Rockies during that game. And the first baseman went and he was going to throw. We were kind of right behind first base. And he was throwing
Yeah.
the ball to somebody in the crowd, and he didn't make it over the net. It hit the net and bounced back to him. Okay, that is what this like HIPAA like points out. It's like that's how much we're failing people, and by people I mean patients, dental practices. When it
Yeah.
comes to HIPAA, we're not even we don't even know what the title means, let alone like how to do, let alone do it. That's our version of not being able to throw a ball into the crowd from the Colorado Rockies. Probably
I don't know if you're played
probably a
with
lot of
my
unhappy
minors.
Colorado people, but boy, they were bad.
Hey, they have been bad this year. So no, I don't. But hey, I live in Kansas City. I've paid for a lot of bad baseball over the years too. But no, that's
I think you've had the best barbecue of any stadium. Sweet Baby Ray's
yep,
Kansas City. Oh,
yep.
that's the
Thank
best.
you.
Oh my
Appreciate
gosh, that's if
it. And my boys
I
are
think
on
it's
tear
amazing.
right now. We'll see how the rest of this season goes. But anyway, Bryan, I guess I'll wrap up real quick before we leave, though. One more time, give us the title of the 3 books and the name of your podcast so people can find you.
The first book is The Patient First Manifesto. The second book is Dental Disorder. And the third book coming out
Yeah,
very soon is called Unfair
October
Care.
2nd.
It's available at unfaircare.com.
Okay,
And my podcast, The Patient First Podcast. So
cool.
yeah, thank you very much.
Yeah,
Love
are the
all the work you're
books?
doing and appreciate you having me on.
No, thank you. Are the books available on Amazon or
Yes,
through the
they are.
website?
Yeah, you can
Okay,
also go to bryanlaskin.com. They're available
okay,
there.
very cool. Well, Bryan, thank you. I mean, this is super cool. I knew we'd have a great conversation because we never get a chance to connect and talk enough. So I knew this was going to kind of be like drinking from a fire hose, but this has been awesome. The the whole thing on portability, I'm stealing that because people need to know about that. But that's so true. That was just incredible. But anyway, thank you. We'll get you back on at some point and we'll talk about your next projects and how this whole interoperability thing is going because I think it's intriguing. Everybody, thank you very much for watching and listening. This is the Technology Evangelist podcast, sponsored by Medidenta Digital. I'm Dr. John Fluke and my buddy Bryan Laskin. Thank you very much. See you soon.